Alright, so I would gather my supplies or check the patient's chart, see what liter flow, what they're here for, just kind of get a general idea of their chart. So then I would gather my supplies. Right now, the patient, we're going to put her on 4 liters per minute on the nasal cannula. So I have a oxygen tank in the safety transport cart. It always needs to be in a cart. It's green, it has the different markings, it says oxygen on it. And then for the regulator, we have a PISS connector system. Before connecting the regulator, we kind of crack the O2 to get all the debris out. And then we can tighten that, then we're able to turn it on. And then, so we have 1500 PSI. So for the cylinder duration, just to be safe, we'll subtract that by 500, times it by the cylinder factor, which is 0.28, and then divide it by the 4, and we get about 70 minutes of O2 left. If we're able to turn it on, and we can hear the oxygen. So then I can connect my nasal cannula. So then I got all my supplies, knock, enter the room, identify myself, say what I'm here for, identify the patient, and then we go through and give them oxygen safety, make sure no smoking signs, always keep it in a tank upright, don't use Vaseline on your nose. So then we are able to, the prongs go down into the nose, and we're able to turn it up to the 4 liters, and we can hear the oxygen coming out. Then all of a sudden, the patient, let's say, desaturates, and so we will take them off the O2 tank, and we'll switch over to a 4 tube, and we'll just be able to connect it to the wall. And we can tell it's compensated because the ball kind of jumped. And we'll be putting them, their O2 stats dropped to 72%, so we're going to put them on a rebreather mask. Minimal flow is 10 liters per minute. If the bag isn't inflating properly, we just need to turn it up to a higher flow. We would have our nipple adapter, which we don't have, and we'll attach it, and then we'll just have the patient lay comfortably, and we'll just put on the mask until their stats go back up to normal. And we'll just kind of monitor vital signs. We'll do like before and after. And then following that, we will like chart all the patient's vitals, what happened, kind of do our post-assessment charting. And then to go back to the oxygen tank, we're finished with this, we're gonna put it away. So we will make sure everything's turned off. We can disconnect it and leave it in the patient's room if they'll be needing it in the future. We just make sure we take this off. And then we can just do the pressure release. And then we're able to store it in the proper room with the oxygen signs and no smoking.